Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm RJ Infusino, filling in for Gretchen as your host, exploring the policies and ideas that are transforming the aging experience. This season, we're diving into what it really means to age well. From staying connected and keeping our minds sharp to finding our passion and taking care of our mental health. Today, we are joined by Robyn Golden, a nationally recognized leader in aging, social work, and healthcare innovation. As the Associate Vice President of Social Work and Community Health at Rush University Medical Center, she also chairs the Department of Social Work. Robyn helps bridge healthcare, social services, and community based support systems. We're also joined by Robyn's colleague, Caryn Blanton, a clinical social worker and program manager for the Center of Excellence for Behavioral Health Disparities in Aging, where she helps advance education, resources, and best practices to improve mental health care for aging populations. We'll be taking a deep dive into mental health as we age and how we can care for our own and others' mental health. Thank you so much for being here. I'm very excited to be talking with you both.
Oh, thank you. Yeah, we're happy to be here.
You're both social workers, so it's clear why you're in the field of behavioral health. But with all the different areas and facets of social work, what were some of the driving factors that moved you both towards addressing mental health as we age in particular? What was the distinction?
It's interesting. My career, some of my career was at a family service agency where we saw people of all ages as well as families with kids. And we had a system of choosing. We had the ability to choose our caseload, if you will, or the clients we wanted to see. And I had a tendency among our 15 other staff to choose working with older adults. And they were always wondering why and questioning why and thinking, what's this about, Robyn? Are you thinking that maybe working with older adults is just about care management and getting resources and connecting with services and all those kinds of things? And the irony is, I saw in my counseling psychotherapy practice with older adults them uh, embracing the process in a way that they wanted to explore themselves in ways that sometimes even the younger folk didn't want to do. So there's incredible openness, and their wisdom too was just palpable, and I learned so much from them. And so that's kind of how I evolved into it. I didn't necessarily go to graduate school saying, I'm going to work with older adults. It was an evolution. And to the point where I was so enamored by it that I ended up working in an agency that just saw older adults after that. But go ahead, Karen. How would you answer?
Gosh, I kind of found my way also, I think at earliest, just thinking about noticing how differently my grandparents aged was a big part of that, where one may have been more mobile or independent than the other, and kind of having some curiosity about that. But I also always think of my internship. I worked in consult liaison psychiatry as an intern, which is behavioral health services that are in the medical setting. So someone who is admitted to the hospital and also has a mental health need, that team would provide that support. And just working with older adults in the hospital setting who were facing ageism, I think really by the providers. One patient in particular stands out where he just, had been admitted for something fairly simple, I believe. There wasn't a whole lot going on, for him, but he was in the hospital and we got to talking and he told me he was a physician. He hadn't told his medical team that. And so when they came in, they were using some elder speak, as we say. So they're kind of talking down to him like, "Oh, why are you here today?" Kind of in the voice you might use for a child or a pet. Um, and I wish I would have asked him, like, "Why didn't you tell them? You're a physician, you're equals, right?" And they were just treating him that way because of his age.
Yeah. My my grandfather, I'd like to think he was a he went through a little bit of ageism when he was in the behavioral health setting. Um, my grandma had died like a year before, and it's a traumatic experience. And a lot of what had happened then following, it just seemed like he was getting written off due to his age.
That only reinforces then one's self-concept and self-image, and more depressive symptoms occur because of it. They become more depressed. So,
Worthlessness, helplessness. Like, what's the point of even going to the doctor if they're going to tell me it's not worth it to treat this at my age? Or they're just going to shrug it off and say, oh, your knee hurts because you're X age. When there might be actually a injury.
yeah,
Or
right.
something that could be
Well,
treated.
something that could be done, right?
Yeah, that could
Exactly.
improve quality of life. Well, and my other supervisor, so Erin, I'm Rach Bercio, she's the one of the co-directors. Erin or Robyn, who's next to me, is the other. But she tells a story during some of our trainings that the E4 Center has, where a story of a patient who says, "Doctor, my left knee hurts." And the doctor's like, "Well, it's because your left knee is 80 years old." And she's like, "But my right knee is too, and it doesn't hurt." And so it's like, the yeah, it
It's like,
age
help
and
me with my
are not
knee.
I love that story.
yeah, it's such
Yeah.
a good one. But age and health are obvious or often, excuse me, conflated in a way that they shouldn't be, right?
Well, and then it's the same hopelessness that the fact that somebody says your pain can't be treated or you can't be helped. What does that do? You can't walk around in the same way. You just, you don't have a sense of agency, all the things that go against one's self-image and then how they feel.
When we think about overall health as we age, mental health seems to be something that is oftentimes overlooked. Why do you think that is?
Well, they probably haven't considered their mental health much their whole life, don't you think? Because if you have been someone that age 20 or 25 thought, I'm not feeling so great about myself or my reactions to things or my feelings, I'm anxious, whatever, I'm going to go see a therapist, then that's part of your upbringing, your growing up, if you will. If you've never done that, I think it's harder to do it. But I think there's ways to get beyond that because I think older adults, once they realize that they can make they can make a difference in their life as to how they're feeling about themselves, it makes a huge difference in both in terms of talk therapy and in terms of medication. Um, I think what happens very often is they might say to their primary care doc, and I don't mean to bash primary care providers, but they might say, you know, I'm I'm not feeling so hot, or the good primary care practice will ask a depression question, ask an anxiety question. And if they're more negative leaning, those questions, it depends how much gets delved into as to whether or not, again, the provider might say, well, of course you feel that way. You're dealing with this. You can't drive anymore. You can't do this anymore. Of course you're feeling that way. What would you expect as opposed to saying, would you like to talk to someone about that? So I think it all depends on what you encounter and people you might let out a little expression of that depression to or anxiety. They can be They can instill hope into the situation or they can just close it down very often. But what would you say?
Yeah, I agree. I think a lot of times it's normalized in our culture to be or feel depressed as you get older, kind of the ideas that you're losing friends, you're losing a lot of people in your life, and you're reaching this kind of end of life stage, which has gotten quite a bit further out than it used to be. But I think those ideas are still set into us at a much younger age, right? 50s, 60s, even 40s over the hill, right? Nothing good is going to happen after 40 because you're over the hill. So just kind of keep chugging along. But I think if we stop normalizing and start listening and start being there for our people, um,
And normalize the intervention. Yeah, I always wanted to say to people who are older who could benefit from talking or medication or whatever, a group, you name it, I would say to them, now you treat your feet. You go to a podiatrist if you have such and such. Why don't you treat your depression too? And there's a lack of parity. And it gets played out in a systems kind of way too, because the payment structures get different. We have greater copays if someone is maybe utilizing their Medicare benefits in such a way for counseling. It gives them the message that somehow this work is not on par with that podiatrist or seeing that specialist.
but often this work is what helps people engage in their healthcare.
Exactly, mate. Exactly.
There's a lot of studies that suggest that engaging socially, regular physical activity, and maintaining a healthy diet have a positive impact on our mental health, no matter what age we are. When thinking about mental health struggles, what are some lifestyle considerations to better support mental health even as we age?
Yeah. I think physical activity is something. Not that you have to everyone doesn't need to run to the pickleball court. I mean, I think there's different ways to do physical activity. But I think more and more we're finding, right, Karen, that it's about connection, preventing social isolation, having meaningful relationships and meaningful things to do that seems to be a protective factor.
Absolutely. And since COVID, anxiety has actually become more common in older adults. It used to be depression, not that it's normal in older adults, but just more common.
Right.
So it kind of flipped because there was so much anxiety due to that social isolation, due to not being connected to others, not knowing how you were going to get food, not knowing who was going to be able to take you to your doctor's appointments, not knowing how to get around and get the things that you needed for just basic quality and sustaining of life. So yeah, so agree. Physical activity, whether that's moving your feet in bed, it doesn't have to either be.
Right. It doesn't have to be a major workout with a trainer.
Yeah, it's just moving your body in ways that help your circulation, help things flow, through and clear things out and help your organs just kind of continue to work. Also brings blood to your brain, which then gives you mental
Yes,
energy and other things too. So, yeah.
very true. It's interesting. I'm a personal trainer, and a lot of my clients are older. Um, and um, like you would be so happy to see what they're able to do. When they started working with me, um, they would have just some troubles balancing and just they were concerned about, muscle strength and like movement. And now they do all kinds of things. It's it's really cool.
Well, in some of the services that we provide, like Age Guide provides falls prevention programs. Those are so critical for people to feel more secure to do what you're describing too.
When a lot of it's just getting in touch with your body, right? Like having a relationship with your body to know where you are in space, to know how that step is going to land on your foot that then travels all the way up, right? So just kind of anticipating how you're going to experience movement. And the more you do it, the more comfortable it becomes.
I was talking to a colleague today, a mentor, and in the field of aging, and she's going to be 85 next year, and talked about that 80 plus time that she has noticed such a shift in her physical self that she, during COVID, she and her husband would walk 5 miles a day. And now maybe walking a mile is, she feels it. And I said, how are you dealing with that? And she said, well, it's been an adjustment, but I'm trying not to diminish my capabilities for what they are and still feeling I can do this and that's something and I'm going to do it and not bemoan the fact that I can't do the 5 miles anymore, but I can do the 1 mile a little more slowly, but I can still do it.
Similar to that. So the mental health impact of saying, I'm too old to work out, right? That's a self-worth issue. And when coupled with other symptoms could be a issue of depression or something else going on, right? And so I think a lot of the time people do go into movement, exercise, activities the way that maybe they did them before rather than experiencing them in their current body, in their current state. And so if you do have somebody that you're working with coming back into exercise after a long time, that's a really good thing to normalize. But, let's start where you're at and build up rather than getting kind of discouraged if you try to jump back in, can't do what you used to do and hurt yourself. That's a whole other
It's a whole
ball game.
happens all the time.
It does, yeah.
But those negative self perceptions you're talking about, our colleague Rebecca Levy has talked about that there's a great correlation between suicidal thought and negative self perceptions. So the more you can say, I can't do this, I'm not pretty anymore, I can't work out anymore, all of that list of stuff can accumulate to the point where you don't feel that hope. Um, you feel quite helpless and sadly you might act on it. Suicide in older adults is a serious, serious situation and so often goes unacknowledged.
Well, and with Becca Levy's work too, I'm thinking it's not just suicide that shortens the life of older adults, but just internalized ageism. She has been able to prove that 7.5 years can be your life can be reduced by 7.5 years if you have negative self perceptions of your age. Because it just takes a toll, right? It's just that stress and that feeling of worthlessness and not doing maybe the things that you would or may otherwise have done if you didn't feel those things, right? So you're not keeping up your appointments, your health, your whatever is important to you.
Yeah, two friends of late who have gotten hearing aids, and both of them have approached it in very different manners, but it's still a struggle for both of them in terms of what that means, what they're hearing, even though now they can sit in a situation and maybe hear what they weren't able to hear before, that still having that thing in their ears affecting their image.
While researching more about the both of you, I stumbled across e4center.org and I was blown away by the educational material and various other resources that are available. I know you do a whole lot of training on this, but would you mind just summarizing things like what are the 4 M's of behavioral health? And give me some context on active listening.
Oh, good. I'm so glad you dug in. E4 is amazing. So that's the one I'm the program manager for, and Robyn's a co-director. Um, so we offer a lot of training on there, everything from training resources and toolkits. We were SAMHSA funded or Substance Abuse and Mental Health Administration funded for the last 5 years. And so
That was the federal government Health and Human Services.
thank you.
That's fine.
So many letters in this work too. We sometimes just go into alphabet soup. Um, so we had the opportunity to do a lot of really cool stuff
We're the only center nationally
Yeah.
focused on behavioral health or mental health and older adults and aging. So we were very proud of that.
I was almost ambitious enough to go through the program myself. I work with mostly older people at my other job as well. So it's like it would be a win-win.
Well, and while you were poking around in there, you may have gone to our learning hub, maybe. But we have a learning hub that's with the Center for Excellence in Aging, and the Illinois Department of Public Health has uh, awarded us a grant to do some work on working with folks with memory loss and dementia, do some trainings, I should say, on working with folks with memory loss and dementia for Illinois professionals. Wondering if working in a gym might be a good option to be one of our next populations, but we have things for first responders, faith leaders, public health professionals. We're working on librarians, transportation, senior centers. So there's all sorts of um, free trainings on there. So, and that's why I bring up SAMHSA. And we also had a partnership with 988. So a lot of these um, programs were able to help fund these trainings so we can keep them on our website for free to the public.
One of the best programs when it comes to mental health and aging was called the Gatekeeper program out of Spokane, Washington, and it literally trained people, whether they were hairdressers or postal folks coming to the mail people, firefighters, you name it, to try to recognize signs and symptoms of depression and anxiety. And then they were trained and taught how to engage the person, not scare them away, but hopefully engage and or hand off to someone if they didn't think they were able to engage them or the person wasn't receptive to it. And that program did so much for finding people who needed interventions and then got them because most people, hopefully this will change someday, don't raise their hand and go for help when they need it. And it's even more so with older adults. There's still that stigma associated with mental health. That's part of this age generation. Again, maybe it'll be totally different 20 years from now. Hopefully it will. But right now, we're still combating that stigma. And that's why sometimes having an outreach program, which identifies people in different ways and doesn't wait for them to say, I need something, is really a wonderful way to go at it.
Well, and the four M's, just to mention that, kind of segue right. Well, you segued right into it. The four M's, for those who aren't familiar, is an evidence-based framework that was, I think, one of IHI.
Institute for Healthcare Improvement.
She has all the words. I got the letters, but they their main kind of categories of assessment are what matters is the biggest one, I really think. Mind or mentation, mobility, and medication. And so it's with every interaction in a healthcare setting. I think they specifically were hospital and primary care. The like hope was that everyone would ask these questions to older adults, like tell me about your medications. Tell me about how you're getting around. How would you like to be getting around? Getting to kind of the root of some of the just issues that may be coming up with someone's health or mental health. And Forum's behavioral health is something that our center really kind of built out to make that assessment more accessible for behavioral health providers, because behavioral health providers typically were not comfortable, unless they were prescribers, which very few are. They weren't as comfortable asking about mobility. They're like, I'm not a physical therapist. I don't know. Or medications. And so this helps them have some ideas of what they can ask and also maybe when to refer.
On my mind often when I think about, continuing education is the thought of whether or not enough medical professionals, general practitioners, do enough furthering education within this space to better understand mental health even as we age. Um, do you feel that there's potential and like for growth for that?
We try to reach people, all different professionals, and it's a tough sell for a lot of people. Most of the people we get for our trainings are social workers, right, Karen? And, it's made for physicians, it's made for nurses, all these other professions, but they don't see themselves as needing that in the same way, but they do. So, something we struggle with all the time.
Yeah, and it's so interesting too when you get folks in a room for trainings that they may not think they need to be in.
Right, right.
Especially, you just start to see light bulbs going off about when especially talking about ageism or things that may be common in a certain population. You're like, "Wait, my client did that yesterday. That's what was happening?" Or, "Oh my god, my mom says I'm too old for this all the time, but she's not, and I tell her that, but that's what's happening for her. That's internalized ageism." Okay, right? So, like, these things that we just take for granted or just don't think about, um, once people are in the room, they realize how much it can change the way they look at things and the people they work with and the people.
And how
Oh,
how influential they can be in
yeah,
making that difference for somebody bridging that, with getting the help they might need.
absolutely.
One of the most interesting things in the last, 5 or so years was really concretizing what social isolation and lack of connection connected to, that it is equivalent in terms of symptoms as smoking 15 cigarettes a day when you're socially isolated. And that's all ages. That's just not older adults. But older adults compound that number and it becomes even higher. So that I think that did a lot for us in thinking about programming and thinking about places like Age Guide. How do you make those connections out in the community? How do you entice people to join? Um, there's too much, and I worry about this with our future generations. There's too much of, there's a book written by Robert Putnam called Bowling Alone, and it's about 25 years old, and he has a new book out. Or no, I think he has a special on Netflix or something. And it's still relevant. If anything, people are doing things even more alone than they were at one time. And how do we turn that around to create a sense of community belonging? You don't have to become an extrovert. That's not what I'm saying. You don't have to become the most social person in the room. It's just some sort of meaning and connection that makes such a difference.
Yeah. I mean, if you feel alone, sometimes you feel like, what's the point? Right? We're here as humans in a community, and if nobody understands me and I'm just a burden, then people can kind of fall into this hopelessness and worthlessness. And so the more you can connect with each other and build trust with each other and be respectful of one another and rely on one another, ask for help, offer help, I think all of those things will, help to build a better future.
What are the biggest warning signs for doctors, our loved ones to watch for, particularly in older adults who may be dealing with a mental health crisis? And what would it be different from someone who's younger? What is like the distinction between the two?
There's definitely a lot of overlap in that, people will withdraw from their social circles. Maybe you might see canceling appointments, starting to give things away, those sorts of things, right? Um, but I think in older adults, often I've seen it, especially in healthcare, be giving over the power of your decision making to someone else. I've seen that happen quite often when, if a medical condition comes up and they're just like deferring to their daughter, not from a cultural perspective, like as if that was normal, that's great. But if it typically wasn't a way they would have acted before feeling depressed or hopeless, um, they might say, I don't want to be a burden on my family. Let's just let them decide because I just don't want to be that to them. So let them put me in a facility or let them do what they think that will be best for them, kind of giving away their own self determination and their power in a way.
And if you're older and retired, I think work has always been a place to catch folks or for people to feel like there's some structure, whether or not they love their work or whatever. I don't want to go down that path, but there was some structure. And when that's gone too, you may not notice the symptoms that creep up. It might be harder. So all the more reason that we need to stay connected to those people in our life that are getting older. I mean, how many times have we been in situations socially where you can see people just getting tired of trying to communicate with the older person who's in the corner of the room? It's it's sad, but we all go through it. And how do we get beyond that to see that that person still has something there that we can help bring out?
With this month being Mental Health Month, I think it's important to solidify that mental health, no matter how old you are and no matter where you're at, you are deserving of help. And if you need help, you shouldn't be afraid to look for it. And there's so many resources.
Absolutely. So well put. It's not only Mental Health Month, it's Older Americans Month. So that combination is, I think, what we're talking about today. I just wanted to make sure we talked about family caregiving, which is just huge. More and more people are friend and or family caregivers. They don't necessarily identify themselves as caregivers with that term. But when you ask the question, are you caring for someone in a very, kind of unassuming way, it's amazing how many people say yes. And that's a population who I worry about too, in terms of their sense of stress and burden and isolation and hopelessness and helplessness. That is a group that I think it's critical that we be asking questions of and supporting.
It's another one of those identity things too, right? A lot of times family caregivers, um, it becomes part of their identity. They may have to end their paid work. They may have to end different kinds of things that bring them joy, right? Because they have to focus or feel that they have to focus on the care of someone, which can be.
There's been more and more of a focus the last 10 years on social drivers of health or social determinants of health. Does someone have adequate housing? What's their education level? Do they have food on their table? Do they have transportation? But I think we believe here that those questions should include a question about depression or anxiety. They should include something about, are you a family caregiver? And then something about social isolation. That to me would be a much more complete um, screening and really fit with what we're seeing and what we can make a difference with in terms of upstream helping people in a preventative kind of way.
What are some ways of combating social isolation as we age? Because I'm noticing that it is such a prevalent issue of decline. Like it just seems like that could be a major reason as to why decline happens on a mental health level.
Think decreased interaction, right? That's gonna your brain, it's not a muscle, but it it does require consistent use to maintain its kind of ability. So if you are less social because you're socially isolated, then you may start to have some difficulties that you may not have otherwise. Think about COVID, even
Yeah.
at my age. Coming back into a social space, I'm like, what do I say? What do I say? What's the word? Right? You're just not as practiced. So, um, I think that's definitely one of those things that can occur. with social isolation. But also, you may not be as physically active, right? You're not moving around as much. You're often people who are socially isolated aren't they're tending to their gardens and doing all the things that bring them joy. If they're socially isolated and feeling lonely, those are the folks that you really have to worry about because there's a difference, right? You might have someone socially isolated, but they do the things that they enjoy. Their mental health is good. They're happy. They have what they need. But someone else looking in might say they're socially isolated.
I also can't stress enough that the answer is not necessarily go find other older adults to go hang with, but intergenerational kinds of thinking and programs are just so life affirming for many of us who love seeing kids running around and screaming. Some people don't, but how do you engage with them, and how do you read to them in libraries or help tutor them in schools? These kids don't have the same kind of parents at home that some of us had growing up. And boy, could they use that. And could you feel good then about providing something like that as you're older?
If you don't like kick, there's animal shelters.
Yes, thank you. A lot of people I know are doing animal shelter.
Or cat cafes if you don't want to go to a shelter.
Yeah,
Places
exactly.
you can interact with other beings. Maybe get a pet, right? If you're able to care for one and you like them.
Absolutely.
So I've heard some people say I'm too old to get a dog because the dog will outlive me, right? And so there are some people who that feels like a barrier to, but don't worry about it. And take care of them, give them the love in the home. They'll figure it out because they were in a shelter anyway. So,
Boy.
they're better off at your house.
This conversation's been great. I'm love a lot of the answers that you've given me. You've given me a lot of insight, as well as the viewers that have been listening to this. But if you can give any piece of advice for our mental health as we age, what would that be?
Don't avoid it, but jump in, have discussions, talk, talk openly about how you're feeling, how other people are feeling. It's an amazing thing once you start doing that, how many other people are feeling just like you are. We're very open at dinner parties talking about this pain and that pain in our bodies, in our physical selves, right? But why aren't we talking about the other stuff that probably even matters more? So I think not shying away from it. What would you say, Karen?
I say keep moving as much as you can in whatever way that works for you and stay connected. Those are my two main things. Stay connected to each other, stay connected to yourself. Um,
Yeah, to yourself.
Or-
Don't be afraid to explore yourself.
yeah. And don't be afraid to get help, to talk to somebody, whether it's a pastor or a rabbi or
Absolutely.
a
It doesn't have to be
professional.
someone who calls themselves a psychotherapist if that's intimidating to you, but those people are okay too. Social worker, whatever, talk to them.
Start somewhere.
That's absolutely incredible advice. And I can speak from experience as someone who regularly sees a therapist and psychiatrist. It is something that everyone and anyone can benefit when it comes to looking over your mental health.
You did just what people should do is say that I'm on a medication or I talk to my therapist. The more you can say that and get it out there, the better, because it then becomes normalized. So thank you for saying that.
I will say the best day of my week is when I see my therapist. And I also see a psychiatrist. So, you've got to take care of yourself.
Do.
It's very true. Thank you so much. Your insight has been
You're welcome.
absolutely incredible.
Oh, this is
Wow,
fun.
thanks a lot.
Yeah, thank you.
Hello and welcome to your Medicare Minutes. My name is Val Guzman and I'm the Benefit Access Specialist here at Age Guide. Typically, health insurance is used when you're sick or injured, but Medicare covers a wide range of services that are meant to help you stay healthy. Medicare's preventive services can help detect health problems early and prevent certain diseases. Preventive services include diabetes and cancer screenings, vaccines, and an annual wellness visit with your doctor. And most of these services are fully covered by Medicare. The best way to access these services is to talk to your doctor, and they'll help set up the health screenings and order any procedures you might need. Visit ageguide.org for additional Medicare resources or call AgeGuide at 1 800 528 2000.
Thank you for joining us on the Age Guide, where we explore the insights, experiences, and practical strategies that help us thrive as we age. To learn more about how Age Guide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630-293-5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue exploring what it means to age well.